The Closing the Gap podcast is produced by the Association of Nigerian Physicians in Americas and is supported by the association sponsors and advertising. Hello, everyone. Welcome to the Closing the Gap podcast, brought to you by the Association of Nigerian Physicians in the Americas, also known as ANPA. My name is Glitterati, and I will be your host for today. The goal of the Closing the Gap podcast is to highlight and share the stories of physicians and healthcare workers in Nigeria and the United States and how they're helping to close the gaps in provision of healthcare services to people in need of them. We will also be thanking our guests for their tireless work and finding out what other steps they wish to take in the future to help make healthcare available to everyone, and of course, how we can. Welcome back to the Closing the Gap podcast. And today we have a celebrity special guest from Georgia Plastique, Dr. Stanley Okoro. Welcome, doctor. How are you doing today?
I'm doing well. Thank you for the wonderful introduction.
So, doctor, tell us a little bit about you and your specialty.
Well, I'm a double board certified plastic surgeon in the Atlanta, Georgia area, and also the same in Nigeria. We have practices in Abuja and Lagos, so we do two countries.
That's amazing. And so that you're kind of by a country. So I'm gonna switch the questions a little bit because I know you know I switch the questions a little bit. But there is now a surge of plastic surgery, right? The BBL surge, things are surging with plastic surgery, and there's a lot of wax that are, quacks that are, doing things that are not right. And it's happening, especially there's a big surge in Nigeria as well. Tell us a little bit about what someone has to know when they are deciding to do the work, to get that work done, and what they need to know before they book a doctor or get a doctor who could botch or do something that could be dangerous to their life.
Absolutely. This is the battle of our lives, actually. So I think, plastic surgery is a wonderful thing to do, and it goes well when you select a good plastic surgeon. The problem now is everybody would like to look amazing, right? And all the doctors, even those that are not even plastic surgeons, are getting into the business because they want to make a quick buck without the proper training, experience, or even the education. I mean, the very, very basic question is to just do your homework. Make sure that your doctor is a board certified plastic surgeon. There are some confusion. Most people, not even doctors, know the difference between a cosmetic surgeon or a plastic surgeon because they just don't know. If the doctor doesn't even know, how do you expect the patient to know? Anyone with an MD or doctor degree behind their name can present themselves, at least in the United States, as a cosmetic surgeon without any surgical training, surgical education, or surgical experience. And once you do that, and then patients don't know this because most doctors don't even know this, right? And then the patient will go to the people that present themselves as cosmetic surgeons because they are usually cheaper. Because then people are thinking, cheap is our people are always looking for the best deals. But when it comes to your body, your face, or your life, probably not the best time to looking for the best deal. You should never select a doctor because they're cheaper or they're easily accessible and you can afford, if you can't afford it, this is not a life or death situation. Take your time, do the research, save the money, and go see a real plastic surgeon. If you're in the United States, it's very easy. You can go to plasticsurgery.org and look for board certified plastic surgeon, period.
That's it. You guys shine your eye. Listen, before you take that leap, make sure you have a board certified surgeon. That is the first step. And make sure you're doing your research on getting the right thing. So, doctor, in doing this work, which is enriching, what are some of the, name a memorable moment or two for you in doing this work that you've done in plastic surgery?
Well, plastic surgery is a very wide specialty. It includes reconstructive surgery, of course, cosmetic surgery. In my this oh this year we are celebrating our 14th year anniversary in private practice.
Amazing.
Yeah, so there's so many memorable moments for me. I don't even know where to start. When I, from reconstructive surgery to cosmetic surgery, I think somebody asked me, what do you like to do the most? I answered the question is whatever makes the most impact to the patient. That's what gives me joy.
Absolutely. Absolutely. That's it. I love that simple, whatever impacts the patient the most gives me joy. I
Well,
love that.
it's all
So,
about impact.
yes, absolutely. So, doctor, are you a member of ANPA?
I'm a proud member of ANPA, over 15 years of service. I have served,
Amazing.
I've served ANPA at every level. I was a member. I became the ANPA chapter chair for close to 6 years. I served as the ANPA national treasurer for 2 years. Now I serve as the ANPA foundation president. And I'm also the moderator and the founder of AMPA Financial Webinar.
Well,
I have initiated the creation of MPAG and the AMPA Foundation, two of the three legs of AMPA.
that is amazing. And you have two surgical offices in Atlanta and in Abuja, don't you?
I have US and we have Lagos, and we have Abuja.
Yes.
Yes.
Okay, in the United States. Three.
The US, of course. ATL is our headquarters.
ATL. So they can find Georgia Plastics, which is your clinic brand at where? Can you repeat that again?
So if someone is in the US, they can find, just go georgiaplastic.com. If you're on social media, just IG, TikTok, Georgia Plastics. Georgia spelled out, Georgia Plastic, no S at the end, or
Yes.
georgiaplastic.com. If you're in Nigeria, just Abuja Plastics.
Perfect. Glad that we have something that is our own, that is creating this amazing change in people's lives. So, doctor, I'm assuming that you're Nigerian.
I am Nigerian. I'm 100%.
What part of Nigeria are you from?
I'm born and raised in Olo. Olo
Yes.
is a wonderful city in Imo State. That's where I was born and raised. I grew up there. I went to school in Olo. I'm everything Olo and Imo State. And
Igwe.
yes, Igwe, that's right. Kedu, my sister. Yeah, I'm 100% Igbo, and I'm proud of my heritage. I'm proud to be a Nigerian, 100%, and I try to represent Nigeria as much as I can.
What is your favorite Nigerian food before we go?
Oh my
After you have
God!
worked doing all this work you've been doing, what is your favorite food that you could chop?
I'll give you two.
Okay.
One is my wife cooks the best egusi soup. Trust me, it's like
that's my favorite too, doctor.
If you try it, you will not eat anywhere else. The second one is the seafood okra that she makes for me. So between the seafood okra and the egusi with stockfish in it, life is good.
That one will scatter somebody's place.
I don't eat the fufu part of it because I'm trying to watch my height, right? So I just
not your height.
I'm watching my height. Yeah, I don't want to get too tall. I like where I am right now.
You don't want to be too tall.
I don't want to be. I'm happy with where I am. I don't want to be too tall. I'm okay. That's it. And I don't want to get short. I don't want to get short. I don't want to get tall. I just would like the way I am right now. I wish I could maintain this for the next 30 years. I'd be okay.
Oh my God. Before you go, this was such a great interview. Can you share a few pointers for people that are looking to go and get plastic surgery? What are the pointers? One thing, I know you did it earlier with, make sure you're looking for a board certified, but a few pointers when you're looking for when you're looking to get cosmetic or corrective surgery done.
So, what I would say is plastic surgery is a personal decision, right?
Yes.
It's your body. You can do whatever you want to do it, but make sure you do it safely. It needs to be done.
Yeah.
This is happy medicine, right?
Yes.
So I take care of. I have over like 40,000 patients in our database. I've touched.
40,000. Wow.
Yes, we have a very busy practice. We have multiple providers. So over 40,000 patients in our database that we take care of. It's all personal. It's a personal relationship. So for us, it's about doing what you want. You're not doing it for anybody else. There's a personal misconception about plastic surgery, and I want to discuss that right now.
Okay.
It is not vanity at all.
Okay.
The reason is it's not vanity because many of my patients, I see them there. Most people in the US are obese. That's a fact.
Mm-hmm.
Obesity, right? So when somebody comes to my office, we'll talk about your medical history, high blood pressure, diabetes, and I look at it say and obesity and say yes, okay, fine. We're gonna treat that too. All right. So
Mm-hmm.
after plastic surgery, guess what? Majority of my patients they develop a healthy lifestyle. They start going to the gym, they start eating better. Guess what? Because they don't want to go back the way they used to look. So we have saved life. During the medical clearance, we've had many patients who have now we've diagnosed a lot of high blood pressure because in the
Mm-hmm.
African American community, many of them don't have access to quality healthcare. So we check their
Mm-hmm.
vitals, we diagnose them with high blood pressure, we send them to their doctor, and then they get medical clearance. Majority of them they started with anti-hypertensive medicine. I don't even know how many strokes or heart attack we've saved, or the ones we diagnosed with diabetes because they came to see us and want to look better. It's not vanity. It makes people eat better, exercise better, and then guess what? When you look good, you
You feel
feel.
good.
And guess what?
Absolutely.
The mental
Mm-hmm.
health part of plastic surgery is what I love. So it makes it creates a lot of positive impact in our community. And plus,
Absolutely.
the eye candy is not bad either, right?
Absolutely. Absolutely. Doesn't we are saving our money to come to Georgia Plastics. We are saving. We are saving.
I appreciate that.
We are saving. Thank you, Dr. Okoro, for being here. Really appreciate you, and thank you for shining the light on plastic surgery and reconstructive surgery.
It's a pleasure. I'm honored by the invite. Thank you.
Thank you. Have a good night.
Good night.
At this point, we will be taking a break and will come back shortly to meet our next guest. Please stay tuned. Regions Healthcare Hospital and Specialty Clinics provide medical services for stroke patients, including neurosurgery, general cardiology, and critical care services. We also provide physical, occupational, and speech therapy rehabilitation services, including drug and clinical psychology counseling. Our hospital is located at kilometer 17, Owerri Port Harcourt Road, Imo State. For more information, visit us online at www.regionsneuro.com. Again, www.regionsneuro.com, or contact us via email on admin@regionsneuro.com or by telephone at +234 704 700 0011. ANPA Closing the Gap podcast listeners can get a 10% discount on initial admission and additional 10% discount on cardiac services when they mention ANPA Closing the Gap podcast. Faith and Power Ministries Louisiana is proud to announce the launch of a new book authored by Dr. Toby Moma, titled Gracing Favor, the Two-Leap Gate for Unparalleled Greatness. In this book, Dr. Moma shares scriptural insights on how to experience God's divine grace and favor. Gracing Favor, authored by Dr. Toby Moma, is available for purchase on Amazon and Google or by phone at 1-631-747-6071. As you read this book, get ready to experience God's divine grace and favor. God bless you.
Welcome to ANPA Closing the Gap podcast. I have an exciting guest. Dr. Tosan, how are you doing today?
I'm doing great. I'm happy to be here.
Oh, that's amazing. Please introduce yourself and tell us a little bit about what you do.
My name is Dr. Tosan Oruwariye. I'm a Board Certified Pediatrician, and I see children from ages 0 to 26 years in the Bronx, in an underserved area of New York City.
That's amazing. We have to make sure that our future generations are all good. So you holding that part down. In the Bronx, there are definitely some underserved places as well as Harlem, where I'm from. So could you tell us how you help close the gap in the provision of the healthcare that you do?
So if you know New York City well, or New York State, the Bronx is the lowest county rated in the state. We're number 62 out of 62. So there's a lot of work to do in terms of healthcare. We have the highest morbidities in terms of asthma, high blood pressure, diabetes, most of the chronic diseases. We also have something called the social determinants of health, which is how social factors affect health. So we have poor housing stock, poor air quality. All these things affect the health you have in your community. So I chose to practice here because I trained here, and I wanted to share my knowledge with my community, people that look like me and also need my services.
That's amazing. Thank you so much for all the work that you do. What are your most memorable experiences in your profession? What have been some moments that you will never forget?
So I think for me is seeing when you make impact, when children you've seen from zero when they're born grow up to have their full potential, knowing the challenges and obstacles they've had along the way. You've seen children that never thought they would go to college or even become doctors call you and say, Dr. Tosan, I'm in medical school. Thank you. They saw a role model that looked like them. They saw somebody that encouraged them, their dream, pushed them to expect more. And that's one of the memorable things I think of my profession. Yes, as a
That is
doctor,
amazing.
I have acute things. I see when people get sick, I make them well. But for me, I look at health on a very holistic level. It's not just about your cold, it's about fulfilling your potential, and health being one of those pillars to help you do that. And so that's what I'm most proud of.
Thank you so much for sharing. So are you an ANPA member?
Yes, I am.
For how long?
I'll say for about 5 years.
Have you ever gone on a medical mission yet?
I haven't.
Okay. This is
But
your
I've
reminder,
supported,
doctor.
I've supported lots of medical missions.
Okay, that's good. That
Yeah.
counts too. So talk a little bit about the local one that you supported.
So I support the international mission. I raise funds, I get supplies, participate in the meetings to learn and support logistics and all that. But locally, we do a lot of outreach to the Black and Brown communities. We do health fairs, blood pressure screening, diabetes screening, high blood pressure, obesity management, diabetes management. So we do all of that in the community. And the AMPA members, we work together to do that. We also do a lot of health education. We AMPA doctors get together and they form like a panel of doctors. And usually, when we do these things, we have both cardiologists, nephrologists, internists, pediatricians, physiatrists, psychiatrists, all coming together to share their knowledge with the community, educate the community about their healthcare needs, ensure they have adequate referrals. And not just in medicine, we also support the communities socially when we can. Like when there was a fire in the Bronx, we outreach to that community with supplies. We offered mental health services for them to cope with that kind of devastation. And then we do a lot of mentoring as an organization for young people. We want Black and Brown people to get into the profession. So we participate in programs like mentoring in medicine. We do resident resilient support groups to encourage doctors to stay in the profession despite the hardships of the service. And so we do a wide variety of things. We also support the wider New York City community. We participate in the City Code Drive, the mayor's efforts when he's doing any outreach in the community. So we have a good breadth of activities in New York.
Oh, that sounds amazing. Well, that's you've done your mission. You've done mission work. Never minimize, because we're both here and abroad. We're not only we're not all back home. We are here. Nigerians are here.
Yes.
Africans are here. Diasporans are here. So we
Yeah.
need we definitely need impact on both sides, because healthcare is not cheap right now. Actually,
No,
so
no.
it's not cheap here. So definitely thank you for all the amazing work you do. So, doctor, I'm assuming that you're Nigerian.
Yes, I am.
What part of Niger?
I come from Warri, that's in the Delta State.
Worry no carry last, doctor.
Never they carry last, no. Never. Although everybody has taken that slogan. It started in Warri, now the whole world know they carry last. But anyway, we accept it.
Yeah.
And my husband comes from River State.
No, that's where I'm from.
Oh, really? Where?
In Donny.
Okay, my husband comes from Abonima.
Oh, wow. That's amazing.
Yeah.
That's amazing. A perfect match. Rivers and Worry people.
Yes, but waterside people, as we say.
Water people.
We like fresh fish.
Oh my God, this has been so great. You've shared such amazing information, even more than I even expected. I wanted to ask you, if people want to have questions for you, want to help with some of the efforts that you have going on here, do you have an NGO or your contact information so people can, learn more and do more with you?
So really, any efforts we do should go through the national chapter. Any info at ampa.org, any support they want to have, they can specify they want it for the New York chapter. But all the contributions should really go to the national chapter. And then if they want to have specific messages, I could share my email in the chat here. I don't know, do you have a chat here? Yes, I can see a chat. I can share the email.
All right. Thank you so much, Doctor. Thank you, Dr. Tosan. Thank you so much for being here and being here for AMPA Closing the Gap podcast again.
Yeah, thank you for having me and for doing this. We like to share what AMPA's doing. We do a lot of work. Yeah.
Absolutely. Once again, thank you.
No problem.
Have a good night.
You too.
At this point, we will be taking a break and we'll come back shortly to meet our next guest. Please stay tuned. Georgia Plastic and Reconstructive Surgery specializes in cosmetic plastic surgeries to help our patients get their best self out. Services we provide include facial rejuvenation, breast enhancement, liposuction, and tummy tucks, and other body contouring procedures. Our office is located at 2285 Aspeed Avenue Southwest, Marietta, Georgia. Come in for a consultation or contact us at www.georgiaplastique.com, by email at info@georgiaplastique.com, or by telephone +1 770 464 5485. Our team of board certified surgeons will be happy to answer any of your questions. Also, visit us on social media on Facebook, Instagram, Snapchat, and YouTube by searching Georgia Plastic. Get your best self out there today. Sincerely Your Gynecologist is a creative nonfiction book authored by Dr. Ngozi Osuagwu, a real-life gynecologist and Benjamin Franklin Award finalist. In this book, Dr. Osuagwu addresses women's health issues and conditions ranging from adolescence to retirement age. This book is written in letter format, making it easier to discuss medical conditions and issues affecting women. This book aims to foster intergenerational conversation among women of all ages around different medical conditions. Sincerely Your Gynecologist is published by Ben Bosa Books. Can be purchased from their website at www.benbosabooks.com, or Amazon, Google, or directly on the author's website at www.ngoziasoagumd.com. Questions about the book, its author, and other inquiries can be sent to queries at benbosabooks.com or to 1-614-565-0311. Sincerely Your Gynecologist.
Welcome to the ANPA Closing the Gap podcast. I have a special guest today, and I'm going to jump right in and bring up Dr. Peace Nwegbo. How are you doing today?
Hi, I'm fine. Thank you, Aisha.
So we got a lot to talk about because you're in the trenches with your profession already. So
Yes.
so I want to hear more. Please introduce yourself and tell us a little bit about your profession and what you do.
Awesome. Thank you for that warm welcome, Aisha. My name is Dr. Peace Nwegbo-Banks. I'm a board certified obstetrician, gynecologist. I deliver babies. I take care of women's gynecological needs. I work inpatient, outpatient, operating room, antepartum, labor and delivery floor. Being an OBGYN is really exciting because first, you're the only person in the hospital where you see people kind of happy and excited. But, you're also in different parts of the hospital too. So you're also in the operating room, you're taking care of people who may be having a high risk pregnancy, you're delivering, you go to the clinic. So it's so fun in the aspect of all the different ways you can practice medicine and change women's lives.
You kind of pivoted literally into the next question, which is how are you helping close the gap and providing healthcare to
Yes.
women? Mm-hmm.
So I've had an interesting career so far. I've done hospitalist work, or I'm essentially an emergency medicine doctor for women. So if a woman comes in the hospital, she doesn't have a doctor, I deliver her baby. She has an ectopic pregnancy, I do her emergency surgery, whatever that is, whatever she comes in for. Following that, I had my own private practice for about 2.5 years. And that was really exciting in the sense of like being able to take care of patients with a level of continuity one-on-one. Most currently, I'm working as a locums physician. So I take care of indigent patients in my community by seeing them outpatient and also in the inpatient setting too. So if they need to deliver anything, I take care of them in different settings. And they're essentially in the community.
That's amazing. That's amazing. You're doing God's work in every way, in every sense of the word.
Amen.
So in doing the work, which is OBGYN, which is something that sometimes it's, it's a little bit more, when we're talking about here, it's a little bit more accepted for you to go see your GYN, but people still are not comfortable. What are some of the, what are some of the nuances or things you need to let people know to be comfortable enough to come and see your GYN or go see your OB when you are pregnant, things like that,
Right. Well, that's a loaded question because,
demystifying.
What's neat about being a physician is that you're in a position where you've also been a patient. So I think that like having been a patient too, I can extrapolate what I appreciated from my physicians. And so I encourage patients to seek a clinician who makes them feel welcome, who listens, who provides a warm environment, who they walk in and their energy is just like trusting. Um, I've had doctors who made me feel like I was invisible. And I've had doctors who've made me feel like I was already healed before I got my prescription. So I think it's important for patients to just find a clinician, physician, etc., that makes you feel like you can tell them everything, that you can trust them, and that you can have a good experience, because even that experience is healing.
I love that. So it's holistic healthcare you're talking, like you're thinking of,
It
like
is.
really
It
like,
is.
holistic from the way the person
Right.
walks in and you welcome them in. Cause you are right. There are some doctors that are very hands offish and like,
So
here's this, this
cold.
is this is cold. And you don't feel safe to kind of, let them
You
know some of
don't.
the secret, what you call a secret, right? Or it's things that are personal to you. So I love the way
Absolutely.
that you just prefaced that piece, that Dr. Peace. That was
Thank
really,
you.
really amazing. So Dr.
Thank
Peace,
you.
are you an ANPA member? I hope you are with all of this love
Oh,
and
yes.
peace that you put through these
Oh,
airways.
when I tell you I love ANPA, so I've been in ANPA since 2018. My tenure started as treasurer of ANPA Houston. So I'd gone to a few events prior to that, and I was like, I want to be a part of this. I love the vibes. I love the people. Like, this is Black excellence, like epitomized. So I was like, I need to get involved. So I started as a treasurer, and I continued on as the basically the vice president equivalent. And then I'm currently the chairwoman for the AMPA Houston chapter, and it's been a wonderful ride.
That's amazing. So you were here for the event at the Marriott then.
I could not attend that.
We missed you.
Yeah, I could not. I had a family kind of emergency, but I had my hotel room, everything ready to go that I had to cancel. But I was
So this
at
year we'll
the.
see you in Cali.
Oh yeah, I already got that lined up. I'll see you there.
Definitely, definitely, definitely.
I got to hear
So
Chimamanda when she was here in I think 2019, so that was a really
you
great
did. That's
convention.
amazing.
It was
That's
amazing. Yeah, it
that's
was amazing.
amazing. So our Nigerian women are just like beyond words. Let's just say that. Have you been on any medical missions?
So no, and it's heartbreaking because that's on my list. Like one of my previous colleagues, right around the time that I could have the wherewithal to like go and afford it, mommy duty. And so my long-term goal, even short-term, I would say in the next couple of years, my kids are a little bit older. They're going to have to come along and we go treat and take care of our people. Yeah.
Dr. Peace, we're gonna revisit this. We're gonna come back and ask you in 5 more years, have you gone on your mission?
Okay. Please hold me accountable.
We're gonna hold you accountable. Oh God. Before we go, this has been such a it's almost like I'm having just a conversation with a friend because this is really just an amazing conversation. Before
Likewise,
you
you're so
go,
cool.
before you go, what are some things that you can tell women like that they can do before they go see the OBGYN to make sure that their sexual health as well as their just that the health around, your health, your OBGYN health is on point. What are some things that you can
Yes.
share?
So first, I recommend that patients have a level of breast awareness. So it's important to know what your breasts look like and feel like so that if anything is different, you can communicate that with your doctor. Like, hey, I felt this bump. I'm feeling pain. I'm having skin changes. And it doesn't necessarily require much, just being aware of them.
Yeah.
You'd be surprised how much you can gather when it comes to that.
Dr. Peace, before you leave, is there any one tip or two tips that you can share for women to make sure that their women's health is on par?
I recommend for patients to first have a level of breast awareness, knowing what your breasts look like, feel like, will give a lot of information if you start to feel pain, lumps, bumps, skin changes. So I really want patients to just be aware of that. Don't ignore it. Pay attention to your body. I also encourage for patients to have a level of time for yourself, just time for reflection, time to process, even if you wake up 30 minutes earlier than usual in the morning. It's really critical so that you can just reflect on the life that you want and the goals and steps that you need to take to get there. Meditation, prayer, whatever that would entail, journaling, but time for self and for creativity and reflection. Lastly, I encourage hydration. I actually have a lot of recommendations, but I'm just stopping at hydration.
We're going to get your information so you can share that in case somebody has needs to know more.
Absolutely. But staying hydrated, you want to drink half of your weight in ounces daily. Keep that moisturized. It'll keep you moisturized, her down there moisturized, skin popping.
All right. We need to make sure everything is hydrated.
Hydrated.
Hydrate. So, Dr. Nwegbo, before you leave, do you have a contact information or NGO you want to share with us so that we can continue this conversation? Because women's health is a continued conversation.
Absolutely. So my website is drnwegbo-banks.com. That's DRNWEGBO Banks.com. And my email is very similar. It's Nwegbo-Banks@gmail.com.
Thank you so much,
Thank
Dr.
you.
Nwegbo. Such an interesting conversation. And you just, demystified women's health. It just, it's something you need to do,
Just
get
do
it
it.
done, and make sure you stay hydrated.
baby. You'll thank me later.
Thank you so much. Hope you come back again
Absolutely.
soon.
Thank you, Aisha. Nice speaking with you.
Nice talking to you too. Bye-bye.
Wow. Thank you for staying with us till the end of the show today. This has been the Closing the Gap podcast, brought to you by the Association of Nigerian Physicians in Americas, or ANPA. Remember to follow us on Facebook, Twitter, and other social media platforms. Our social media handle is ANPA. Just look up ANPA and you'll find us everywhere. Thank you. You can also visit us at www.anpa.org for more details about upcoming events. Finally, remember to join us next week for our next Closing the Gap podcast, where we'll have a whole new set of guests doing amazing things to close the gap and make the healthcare services more accessible to people in Nigeria and the United States. My name is Glitterati, and it's been a pleasure being your host today. Till next time, stay healthy and goodbye.